Hi, this video is the hair transplant surgery. Before surgery is the art of hairline, and this client flew in all the way from England, and basically he has micropigmentation done in the past. And you know, micropigmentation is pretty good, but unfortunately the color will fade. It will look pretty good a few years. Unfortunately, the color will fade through the years, so you have to do multiple times. And micropigmentation is not real hair, so after a while you can't really grow the hair, and you keep shaving your head, and so you know, it's gonna be more noticeable. So the best option is to really hide it, is to do a hair transplant. And he has a, and so he flew in all the way from England for me to do the FUE method, and to basically fill in the whole area and filling one at a time. So we're going to anticipate around maybe 2,200 grafts, and 2,000 is around here, and maybe to a total 100 something per side, or up to 200 per side. So we don't know until we do the surgery. From the mid eyebrow to the hairline for Asian and Black is around 6.5 to 7 centimeter. For Caucasian, it's around 7.5 to 8.5. And for the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. And then we gotta understand about the temple as well. If you can see, turn this way, the hair pretty much tilt, the temple edge is kind of tilted backward. So you want to straighten that down up a little bit to bring forward. The reason we do that is because if we lower the hairline without bringing the temple, you're gonna have a nice low hairline, but unfortunately it's a wide forehead, and it draws attention. And your goal is to not draw any attention at all. And so we want to be proportional vertically and horizontally as well. Again, you need both an artist and a surgeon to give you the most natural and dense hairline. The artist will give you the naturalness of the hairline and then how proportional it is. And there's a lot more detail than just drawing it. But when I do the surgery, I have there's a certain type of hairline to this medium tight, soft, and tight hairline. And then the angle of the hair, selection of hair graft is important. And then the surgical skill is important, because if you want the FUE and you want the best and surgeon who are specialized in the FUE, then you want a surgeon who can do a FUE manually by himself or herself. And I've been doing the FUE for over 13 years. I think it's 14 now, almost 15. Anyway, we started for many years ago already, and that's how you know the surgeon is good or not. And again, well, with hair transplant, you cannot have the FUE, the extraction of the graft by a technician. I mean, you know, there's no comparison when you have that versus the surgeon. Of course, it's the place where it's operated 100% by technician, then the place will be cheaper. But if you want the best result, then you got to go to the clinic where the surgeon manually harvests that out one at a time, and he has been doing it more than a decade. And how do you know the surgeon does well? Just look a lot of before and after. And so there's two things that people really seek me out for. Number one is how natural the hairline is. Number one, that's the artistry of the hairline. Number two is the FUE method. Of course, I perform both FUE and FUT. The density is going to be given. So this is the art of hair transplant restoration surgery result on a client, man, who flew all the way from England for me to restore his hair. Thank you.